Hi, my name is Antonio Torres. I'm a student at Colorado Christian University in the Healthcare Administrators program. We recently did a informal interview with a friend of mine, former um, supervisor. She was the manager of the clinics that I worked at, and she is still currently managing um, both of those clinics. I'm sorry, she has changed her management to three other clinics within the same um, organization, um, which is located in Greeley, Colorado. And they are the Sunrise Clinics. Her name is Ashley Garcia. The clinics that she manages are the Sunrise Adelante Clinic, which provides care to adults. The Sunrise Prenatal Clinic, self-explanatory, takes care of those women who are expecting or recently delivered, and Sunrise North Range Clinic, which, if I am correct, I apologize, I didn't look further into what this clinic specialties are, but from what I am familiar with, growing up in this city, North Range is for mental health issues. So she has been the registered nurse clinic manager at these facilities for some time now, and I was able to ask her a little bit about the Affordable Care Act, or ACA as I will refer to it as for the remainder of this video. And I just asked her basically how the ACA has affected her professionally first, and she said that it has affected her professionally by allowing their clientele, the patients, to have access to affordable health care and to shift them from going into the emergency rooms for their health care, and thus freeing up the emergency room to take care of emergency visits. Um, these patients also have access to care that they didn't have before, whether it be because of financial constraints or the fact that they just didn't have the money to pay for their prescriptions and treatments for chronic illnesses. Personally, she said that the ACA has not affected her much. I asked her, if the insurance premiums for her and her family have increased or decreased, because I did a little research for one of our assignments for class, and saw that majority of premiums have increased. Not extreme amounts of increase, but in recent years, I should say, but they have increased on average around 1 to 3% is what I was reading. Um, she said that according to her insurance premiums, she's noticed that they've stayed about the same. I asked her if her coverage has changed or not. She said that it has become a little bit more strict in the fact that she has had to get more prior authorizations and referrals. I asked her about regarding the volume of patients qualifying for Medicare, Medicaid coverage, because at the Sunrise clinics they have people who are there to help you register and enroll in these insurance plans provided by the state of Colorado. She said that the volume of patients qualifying for medical coverage increased initially with the rollout of the ACA. I'm quoting her. And people who would not have normally qualified prior to ACA now qualify for coverage. Some of the reading I have done, yes, people are qualifying for Medicaid and Medicare. However, one article, and all of these articles that I'm referencing will be in my, it'll be, I'll have them available on my sublink there, whatever you want to call it. Anyways, what I would have read through a majority of articles is that yes, people are getting Medicaid, Medicare. However, these middle income Americans are getting insurance, but they are underinsured because they have insurance, but the insurance plan may be maybe a high deductible. So let's say for an individual, maybe $10,000 to $12,000 for the individual, meaning that you have to meet $10,000 to $12,000 in payments to your insurance company for services rendered. So if you go in to get an x-ray, I know working at facilities I've worked at, x-rays typically run around $75 to $80 an x-ray, and that's for a simple chest x-ray, let's say. I don't know if prices have changed in the recent months or not. This has been a couple years that I had to pay out of pocket for that. Anyways, so there's more people who, once you get that x-ray done, if you have insurance and you have a high deductible plan, what happens is you then receive a explanation of benefits from your insurance saying, we covered this much, you're responsible for this much. So that responsibility portion goes towards that $10,000 or $12,000. So all the reading I've done has pointed out that patients, are now more underinsured after the ACA has gone into effect. I did ask her again if she's noticed an increase or decrease in coverage reimbursements. She said that they've seen an increase in Medicaid visits, which, as I stated, more people are on Medicaid now, since the ACA allowed them to obtain coverage. And so, yes, you're getting more people on Medicaid, and they're able to come in and get their prescriptions and get their basic treatments and screenings and such. However, like I said, these middle of the road, middle income Americans are not able to afford that, and therefore there are a lot of them who are underinsured. Ashley did tell me that their clinic gets paid per visit, not by the service. So they can provide as many services as they want. They only get paid by the visit. And then she said on their end as well, with Medicaid, I've experienced this. I worked for 12 years as a medical assistant. With Medicaid, you're always getting prior authorizations, whether it's for medication or whether it's for a procedure in office, which would be at the provider's clinic, or if it's for a surgery. There are very few things that they just approve automatically. One of the last things I spoke with Ashley about was the cost increases or decreases that she could think of as a result of the ACA. And she said that one cost that she's noticed with the ACA that she's seen is that there is an increase in number of emergency room visits and utilization. And her recommendation is to educate patients more on what is an emergency and what can wait till the next day to be seen by their provider. And then that is kind of going back into the pre-ACA days of where people were using the ER for primary care visits and such, and increasing the wait times. And then what that in turn does is raises the cost of ER visits. So, essentially I asked her, how has the ACA affected you professionally, personally? Have your insurance premiums increased or decreased? What about coverage? Has that increased or decreased? Regarding the volume of patients qualifying for Medicaid or medical coverage, has the number increased or decreased? Then I also asked, have you as a manager noticed either an increase or decrease in coverage reimbursement provided by Medicaid or a decrease for your patients. And then my final question again was, what other increases or decreases can you think of that are the result of the ACA and subsequent supporting laws? So the reason I asked her if it affected her professionally and personally was because what I've been reading about, what I've been learning about is, you know, this law, the ACA, is going to affect you personally in that it's either going to raise or lower your insurance premiums. And if you're an individual, it's going to affect you one way. If you are a father, as I am, and I have two teenage children, an 18-year-old son and a 16-year-old daughter, and my wife, who thankfully has a decent insurance plan through her employer, these effects are going to trickle down. So if the ACA allows more patients on Medicaid, Medicare, from what I'm reading, taxes are going up because these are state and federally funded programs. So then where do you get those taxes? You get them from the working class. So somebody in my position as a middle income earning American is going to pay higher taxes, which are going to go towards supporting Medicaid and Medicare, thus affecting my tax rates. But the changes in the ACA that they brought with changing your primary care providers, your premium levels, insurance companies have to make changes themselves to offset these laws and regulations they were forced to obey. So my insurance premiums went up, my coverage changed. The promises made that were you could keep your provider, you could keep your plan, this, that. Insurance companies didn't agree with that, and there was a lot of changes made. So I apologize that this video is a little longer than 5 minutes, but I'm just trying to get my thoughts together and just, how do I want to say, summarize them on this subject. So again, all my references and links, they're going to be in the underneath the title there of the video, and you're more than free to read them and see what you think. And hopefully as Americans we can get this insurance situation situated and figured out.